Hearing loss is something that we often ignore in our lives and we don't always take care of. When we start having trouble understanding people in crowded or noisy situations, or if we suddenly have a change in our hearing, we don't often go to the doctor. And I want to talk today about why it's important to be evaluated for hearing loss and the different types, as also what you can do for it. There are two different types of hearing loss. There's conductive, meaning that your eardrum and ear bones don't vibrate to conduct sound or transmit it from outside the ear canal down into the inner ear. There's also, we call sensorineural hearing loss, or a nerve hearing loss that is usually related to the inner ear, and that's usually a long-standing process that goes on over time because of noise exposure over your lifetime. Conductive hearing loss is often seen when you have fluid behind your eardrum, such as from a cold, or when you go on a flight and your ears block up because you distend quickly and you get pressure and fluid behind your ear. This is usually temporary and can get better, but just know that if you have fluid behind your eardrum, it can take up to 3 months to clear, so you have to be patient as it pops and crackles and goes back to normal. In our office, there are things that I can do short-term, like make an incision in the eardrum, or long-term, like put a tube in your ear, or even do a balloon dilation of your eustachian tube, the tube that goes from the ear to the nose in the back, to get it to open. Often, if you have what's called sensorineural hearing loss, it's something that occurs gradually over time. The one time that you need to see an ENT right away is if you have a sudden change in your hearing. Now, granted, could that be wax causing conductive hearing loss or fluid behind your eardrum? Yes, but in rare cases, it's a sudden nerve hearing loss, and that's when you have usually a viral inflammation knocking out the hearing in one of your ears, and it can suddenly drop your hearing. It's really important to be seen right away for this, because there can be things that I can give you, or steroids that can be injected through the eardrum, not as bad as it sounds, that often can help bring some of this back. Usually nerve hearing loss happens because the inner ear, the cochlea, one of the parts of the inner ear, has more sensitivity to sound over time, meaning in the high frequencies, it's more sensitive to being exposed to loud noises. Over a lifetime, you get exposed to a lot of loud noises. Either it's from some type of work that you do, whether it's aircraft, construction, maybe you've been in the military or in law enforcement, or you just like to go to a lot of concerts and you didn't always wear hearing protection when you were younger. The inner ear can be damaged slowly over time. It can be quickly happen if you are around like an explosion, but mostly it's slowly over time. And there's also a weakening of the inner ear due to age. Just as we get to our 60s, 70s, and 80s, you're more likely to have hearing loss. Some people have genetic hearing loss, meaning that there's a reason in their genes they're more likely to have hearing loss, and those are often patients that have family members or parents that have hearing loss. The reason to get seen for hearing loss is when you come into the ENT's office, I'll check your ear canal and make sure it's not full of wax. We'll make sure there's no fluid behind your eardrum. And then with our help of our audiologists, who are our compatriots, so to say, in your workup of hearing loss, they will do a hearing test, and then you'll come back and see me and we'll talk about it. If you have a nerve hearing loss that's beginning to affect your quality of life, we really talk about getting something done about that. The reason we want you to get into a hearing aid is because it helps not only protect your hearing and help you hear people better, it can also cut down on your risk of depression and dementia as you get older. Now, I know that wearing hearing aids isn't something that sounds really sexy and no one really wants to be thought of as getting older, but it's really important to think about your overall health and how this is going to help you. Not only wearing a hearing aid to bring in louder sounds to the frequencies where you have hearing loss is going to make you understand your loved ones and help you carry on conversations better, it also protects your hearing. Just like if you consider, if you don't use your muscles, the muscle will shrink. If you don't stimulate that nerve where it actually hears, the fibers of it are going to shrink and it's going to atrophy and go away faster than would otherwise. And the one thing that we have new research about that's concerning, there was a study called the Achieve study done about 3 years ago where they put patients in a trial where half of them in their 70s got hearing aids and half didn't. 4 years later, when they checked these patients and they looked at their level of cognitive decline, meaning how well they function with their brain in situations, it was 75% less in patients who wore hearing aids. So it's really important to stimulate the brain so that your brain doesn't shrink and atrophy, that you are able to keep these nerves going and you'll be able to function. Because if you imagine, if you withdraw and you can't understand people in situations where you have conversations normally, you're going to withdraw, you may become depressed, and your brain isn't as active. And that's one of the things that can lead to dementia if you don't stimulate yourself. So that's why when I get a hearing test back from the audiologist and it shows a significant hearing loss, I'm going to recommend hearing aids because it's something that's good for you and it's going to protect your health and hearing for many years to come.